Next, we are going to look into myotome or power. So how do we assess for the power of the upper limb? So according to the levels, okay, according to the level. So we start with C5. So what movement is mediated by C5?
Elbow flexion.
So yes, so we want the patient to flex and we have to resist. So elbow flexion will be, so you resist, flex your elbow, okay, flex. Ah yes, okay. So you resist and see if you can flex and gauge whether it is 4 out of 5 or 5 out of 5. So this is C5. This function is mediated by C5. Next, what do we have?
C6.
For?
Wrist extension.
Yes, so how do you, let's see how the normal movement goes. So what is the normal wrist extension? Yes, so we resist and see if the patient can go against this. So this is a similar examination, a component which comes in peripheral nerve examination. And what nerve will that be? Radial nerve, right? So in radial nerve injury, in a high level radial nerve injury, you will present a wrist drop, meaning you can't perform wrist extension, and therefore that's what we refer to as a wrist drop. So here you can overlap your knowledge with peripheral nerve examination. So you know that in radial nerve injury, high level radial nerve injury, you will get inability to extend the wrist. And here you know that wrist extension is mediated by C6, meaning let's say if you have the lesion, the pathology at the level of involvement at C6, then they may have a weakened wrist extension. So when you overlap those knowledge, then you know that one of the root values for radial nerve has to be C6. Okay. Next will be elbow extension, which is
C7.
C7 will be elbow extension. Yes. So elbow extension, you ask the patient to abduct the hands. So this is similar to what we do in peripheral nerve injury, and ask him to extend the elbow against the resistance. Okay. So this is 5 out of 5. So this is also very similar to what we saw in a very high level lesion in radial nerve. Okay. So when there's a level of injury to the radial nerve at the level of the axilla, you note that they will have weakness of the triceps and they will not be able to perform a powerful elbow extension. So by that logic, C7 mediates elbow extension, and in a very high level radial nerve injury, elbow extension is also lost. So by that logic, C7 mediates elbow extension, and we saw that in a very high level radial nerve injury, elbow extension is weakened. So by that knowledge, we understand that C7 has to be a root value for radial nerve. Okay. Next will be C8, which
Finger flexion.
Finger flexion. C8 will be finger flexion. So we know that the loss of the ability to flex the finger, the lateral third fingers, happens in median nerve injury. So by this logic, we understand that C8 must be a root value for median nerve injury. So how do we check for this strength? So we ask the patient to grip my finger and we try to pull it out to see the strength of his flexion. Okay. And finally, T1 will be
finger abduction.
Yes, finger abduction. So the abduction, okay. So we understand that the dorsal interossei muscles innervated by the ulnar nerve, okay, functions to abduct the fingers. So by that logic, we understand that the root value for ulnar nerve has to be T1. One of the root values will be T1. So what do? We just put our fingers here and ask the patient to abduct. Yes, ask the patient to open. Okay, ask the patient to just open, fully open. Yeah. Yes, and check for the power. So that's the myotome examination of power for the upper limb.